Hello, this FERNE presentation discusses the care of emergency department patients with dizziness and vertigo in an attempt to diagnose and treat serious central etiologies. My name is Edward Sloan. I'm an emergency physician in Chicago. I have served as FERNE president and board chair for over 3 decades. I have no financial conflicts. I encourage you to go to our FERNE.org website and our YouTube channel for more content related to the optimal care of the patient with dizziness and vertigo. And please follow us on social media for more real-time information on the care of all patients with neurological illnesses, injuries, and emergencies. FERNE.org. So we're going to talk about dizziness and vertigo clinical history questions based on the consensus definitions that have been provided to us and discussed in a previous video. So, background clinical questions to be asked of patients with dizziness and vertigo. First, ask about syncope or near syncope. Did you lose consciousness or pass out and woke up in a chair or on the ground? Did you feel faint and almost passed out, like when people see blood? That is syncope, near syncope. Were you unsteady or have any directional pulsion? What does that mean? Did you feel unstable on your feet? And did you feel as though you were veering to the side? If so, we need to consider acute cerebellar ischemia. Vertigo questions. Did you feel like you were moving even when still? Did you feel a spinning, rocking, or tilting motion? Did you have the feeling of falling downward as in an elevator? Did this occur with you moving your head, or did it occur at rest without motion? Have you had this type of episode before, or are you having these vertigo symptoms now? Dizziness. Did you feel a sensation of disturbed or impaired spatial orientation? In other words, did you feel giddy, lightheaded, or dizzy? Have you ever been diagnosed with syncope, near syncope, vertigo, or dizziness in the past? Or have you ever been treated for low blood count, low blood pressure, low heart rate, or low blood sugar? These are all questions that will help you to determine what kind of a problem you are dealing with. So our take-home point from this questions part of the discussion are as follows. Go in reverse order. Start trying to determine whether syncope or near syncope have occurred. Consider unsteadiness with standing and gait, knowing this could represent cerebellar ischemia. Probe the vertigo symptoms. In other words, what type of vertigo? What kind of timing? What were the triggers? And then discuss feeling dizziness last. Following that, you can review what could be systemic causes of dizziness and weakness symptoms, such as low blood count or low blood pressure. Regarding the diagnoses take-home points, I would say focus on systemic diagnoses because they can be determined efficiently. Discuss syncope or near syncope. If so, that's your diagnosis. Figure out whether there's unsteady standing or gait, in which case it could be cerebellar ischemia. And then you'll need to determine whether the vertigo was continuous and current, AVS or acute vestibular syndrome, whether it's spontaneous and episodic, or triggered and episodic, knowing that spontaneous episodic vertigo could represent a TIA. And the non-specific dizziness would then be the diagnosis of exclusion. If you have comments or questions about this part of the discussion, please get a hold of us at fern.org at gmail.com. Thank you very much and have a good day.